And welcome back to blackdoctor.org. I am your host this evening, Dr. Renee, and tonight is See Eye to Eye. So I think that if you watch us regularly, then you know this is a regular show that we do. And today we are joined by two ophthalmologists. So you got three doctors tonight, and I will bring them on. So tonight we have Dr. Ellen Mitchell, who is a pediatric ophthalmologist. So she takes care of our kids. And then we have Dr. Yusuf Khalifa, who it just blew me away. He takes care of half of the sports teams in Atlanta. And he does cornea, LASIK, and retina?
Cataract surgery.
Cataract surgery, yes. So welcome, both of you, and thank you for joining us.
Thanks for having us.
Thanks for having us.
So let's get right into it. We're going to talk about sports eye safety tonight. So we've got both extremes. We've got the little ones and we've got the adults. So Dr. Mitchell, in which sports do we see the most eye injuries?
I would say that, especially in the pediatric population, basketball, baseball, softball are probably the most common things that I would get called into the emergency room for. Racket sports are definitely a potential thing. I would say soccer, hockey, and things like that. A lot of pediatric eye injuries are ball or like finger related. You know, someone gets poked in the eye or elbowed in the face or anything like that.
My sister played basketball as from like 4 years old till all the way through high school, and somewhere around middle school, I think it was, my sister, we all wore glasses forever. So she had glasses on, and they broke her glasses, and that was in the heyday of everyone wearing the wire frames.
Yes.
And all we could think, me and my mom are sitting in the stands, was these little screws in my sister's eyes. And after that, my mother took her to the eye doctor, and she got goggles. And she wore goggles probably 7th grade onward.
Yeah, goggles are a great thing, especially when children play sports. And we'll talk more about that for sure.
Yeah, so she wore prescription goggles, and never had to worry about that again. But her glasses had broke, and like I said, screws, and we were like, her eyes. So,
it's definitely a real concern.
Yeah, definitely. You already covered how the injuries actually occur. Dr. Khalifa, what are common eye injuries seen in contact sports?
Yeah, I mean, I've got a little prop here for you guys. This is an eyeball that you can see the structures of the eye. Starting from the outside, you have all these bones around the eye. Those can be broken with sports like baseball or softball, as Dr. Mitchell mentioned, where the ball impact can break a bone. And I've seen patients before, young kids who got hit in the eye, they broke a bone, and then this muscle gets entrapped and the emergency room doesn't catch it. So you got to be careful with the broken bones from these hard balls hitting the eye. And then you can get trauma to the eyelids, right? So you can get lacerations on the eyelids, lacerations on the skin around the eye. And then as you get into the eyeball, you can get lacerations or scratches on the white part of the eye, the conjunctiva. You can get scratches or abrasions on the cornea, this front part of the eye. If you get poked in the eye, you can also have release of inflammatory cells called traumatic iritis, where you become very light sensitive. If you're poked a little harder, you can break a blood vessel in the front of the eye and get a hyphema. Blood actually it collects in the front anterior chamber of the eye. You can get irregular iris. So this iris can become misshapen from a trauma. You can get a traumatic cataract. So with traumas, this lens can go from being clear to being opaque, traumatic. And then you get into more serious things in the posterior segment where, you can have a poke in the eye and you get a tear in the retina, and you can have a retinal tear and then a detachment in the retina. You can also have trauma to the optic nerve back here, right? So that's a traumatic optic neuropathy. And that's sort of going front to back. I mean, Dr. Mitchell, did I miss anything? I might have.
I don't think so. Vitreous hemorrhage.
Vitreous hemorrhage, yep. So that, again, back here, this cavity here is called the vitreous.
Lift it up a little bit higher, yep.
Yeah, this cavity right here is called the vitreous. And if you get poked in the eye, a blood vessel can break in the retina and you get a bleed into the back part of the eye. So those are sort of the things that we think about when we hear somebody got hit in the eye and is having some problems.
Got it. And so, I mean, obviously, one of the most serious eye injuries in sports, I think the vitreous, right? That would probably be pretty serious.
Yeah, probably the optic nerve. So that there's nothing I can do to bring back an optic nerve. That's
right.
That's sort of we're kind of toast when it happens. Retinal detachments are pretty darn serious because you have to have a surgery to reattach that retina. And then I would say probably traumatic cataract and traumatic glaucoma would be the next couple of pretty serious ones. You talk about also like broken bones and the entrapment of muscles that requires quite a bit of surgery to get that fixed. So those would be my top 5 or 6 of those
Okay.
mentioned.
And Dr. Mitchell, are kids and teens more at risk for eye injuries in sports than adults?
Absolutely. Of course, they're playing more sports, right? Than we, as we get older, adults are not playing as much contact sports as kids are. I mentioned, of course, basketball and baseball and things like that, but also things that increase their risk is less situational awareness, right? And also just like smaller anatomy, they're doing things and moving and not really paying attention to what they're doing sometimes. So, and then also another common thing is these kids just pick up pickup sports, right? They go to the park and just start playing, and then boom, someone gets hurt.
Yeah.
And I think sometimes kids are afraid to tell their parents they had a problem too, so they'll hide it.
Yes, I have seen that. Sometimes it's a couple days later after, like, I will see a child who something happened to them, let's say Friday, but they won't say anything to mom or dad till like Sunday. And then they get into the office, let's say Monday or Tuesday, and they're like, oh, this has been going on since Friday. So, yeah.
Yeah. And this is something I'm sure they talk about as well. Dr. Mitchell, let's talk about concussions. What exactly is a concussion, and what
So a concussion is a mild traumatic brain injury. It can be mild to severe, but we consider it a mild type of traumatic brain injury that is from some kind of blow or jolt to the head. The symptoms vary, and the severity of symptoms vary based off of what happened and the child as well. So oftentimes, most common symptoms include headache, dizziness, nausea, sleep changes, slow thinking like cognitive slowing, and visual symptoms such as blurred vision, double vision, and sensitivity to light.
And how do you diagnose a concussion?
So it's a clinical diagnosis. So you have to have the history of head trauma, and then you assess the symptoms as well. Sometimes, we end up, depending on the severity, children get neurologic imbalance testing as well, too. Imaging such as like CT or MRI are typically not done unless there are other neurologic signs or there's a history that would prompt us to do any kind of neuroimaging.
And so how does a concussion affect the vision or the eyes?
So as I mentioned, it can cause blurred vision or double vision. Sometimes children have difficulty focusing on things up close. They develop something that we call convergence insufficiency, where they have difficulty tracking. So kids often come into the office with, like, they had a concussion X amount of weeks or months ago, and now they're having difficulty in school. Like, they're having double vision while they're reading because they're having some convergence weakness. And so there's some exercises and things that we do for that. But it's pretty common for children to have visual symptoms after concussion. Oftentimes these things resolve over time, but the symptoms can delay their return to activity. So.
And how does a parent know when their kid is clear to get back to the sports after concussion?
So one of the things we need to know is, are they having symptoms even when they're resting, right? So you want to have they want to be symptom-free at rest, right? So they shouldn't be having headaches when they're just relaxing. And then return to activity is typically gradual. So let's say, for example, my son recently had a sports injury. Not a concussion, but another sports-related injury. And he's now cleared to return to play, but it's a gradual return, not just back to full activity, right away.
And then what are some of the long-term effects of a concussion? And then what about multiple concussions?
So a single concussion can resolve over weeks to months, depending on the child and the severity of the symptom. But some people do develop something that we call post-concussive syndrome, where it just takes longer for them to resolve. Now, of course, repeated concussions increase risk of recovery. So it takes longer to recover every time you get a concussion. And the cumulative effect can lead to some neurocognitive decline, and in some athletes, as you know, research has shown some long-term brain changes as well.
Thank you so much. So, Dr. Khalifa, what are signs of eye injuries?
So if we go back to our little model here, things like abrasions on the surface of the eye will cause pain, light sensitivity, blurred vision, especially if it's an abrasion on the cornea or a laceration or some sort of trauma to the cornea. A lot of times the patient, the child or the adult, will complain of pain, light sensitivity, and blurred vision. Those are super common. Red eye and tearing. Those are very common with surface injuries like that. As you get into the eye, traumatic iritis and hyphema, it can be blurred vision, as well as the light sensitivity again would come into play. Things like a vitreous hemorrhage, you'll see these floaters come into play, right? And that's a very serious sign that there is a major problem. Flashes of light for retinal detachments, veils or curtains, those are all serious signs. And then obviously, if a patient says that there is a part of their vision that is black, that gets me super concerned about a retinal detachment or traumatic optic neuropathy. So just to summarize, light sensitivity, pain, blurry vision, tearing, redness, those are all signs that things aren't going well. Now, a kid who got hit in the eye, also, like, let's say they had a broken bone and orbital fracture, they can complain of double vision, right? So they can say that I don't see one image when I look forward, I see, you know, a ghosting or a second image, and they can't resolve it. So those would be the things I'd be looking for after a trauma.
Okay. And I was gonna say, with contacts, I was having such issues, and I would have, my eyes would just be watering and just were red, and they kept saying I needed a new pair, so I kept getting new pairs. It finally stopped, but that's just, I guess that was just an infection.
I mean, contact lens intolerance is a separate issue, but contact lens intolerance can have multiple causes. One is meibomian gland dysfunction, where you have an inflammation of the tear glands on your eyelids, and then you don't make good tears, and the contact lenses don't sit well. Not enough tear production, so you don't make enough aqueous. So it's not just the meibomian glands, but you have some sort of issue where you're not producing enough tears. And then it might be where the contact lens material is no longer sitting well in your eye. You're having allergic reactions to either the contact lens or the solutions you're using.
Gotcha. And what are the concerns with water sports and eye injuries?
You know, water sports, again, you're exposing, if you're not wearing goggles properly, you can expose the surface of the eye to the chemicals in a pool, right? So if you get chlorine or whatever additives they're putting in the pool, that can cause what we call a conjunctivitis, redness of the eye. And it's very common. You'll see a swimmer, right, and their eyes look red after they come out of the pool. That it would be like a allergic conjunctivitis or a chemical conjunctivitis, right? So the other thing you worry about with swimmers is infections, right? So you can get infections from pool water. I have many patients who've gone swimming with contact lenses in, or gotten in a hot tub with contact lenses in, and you get unique parasitic infections with that. Specifically, acanthamoeba is something we really worry about with water injuries in contact lenses. So I got to be really careful with contact lens wear in water sports so that we avoid those really serious infections.
So if you wear them, you need to have goggles on, right?
Yeah, I mean, if you're in serious swimming, I'd probably get a prescription goggles and not put contact lenses on would be my recommendation, just because you don't want to risk the goggles coming off and then that chlorine, that water getting on that contact lens, and then you have a problem. It's difficult though. I mean, these kids don't like they're looking different, right? Or having something different, right? So, you know, even with NBA players, like you're interacting with an NBA player who's not seeing very well, and you say, why don't you just wear goggles? And they say, well, it hurts my brand, right? So they're afraid. It's true, you know.
You're right. You're right.
Kids and even adults, we worry how we look. You know, you see people running around with really attractive sportswear, and they want to look good when they're exercising, and they want to look attractive. So I think it's hard sometimes to sell people on protective eyewear because they think it makes them look funny or it makes them look different.
And just to piggyback on that, with kids, right? Kids who play sports, they don't want to be different from anyone else, right? So it makes it fully convince them. If you can't even get an adult who has a fully fully functioning frontal lobe to make that decision. It's even harder to get kids to do it. So it's very important that we have parents, make the decisions for them to say, hey, listen, you're going to play. We're going to do the safest way possible.
Yeah, my daughters played competitive soccer and basketball, but specifically soccer. My second one was very talented, and she was a -4 myope, right? So she was really nearsighted, just like your sister. I had her in glasses to begin with, and I was like, "This is a disaster because they keep falling off." Looking
Right.
for them on the field, and so and she was too young at the time to put her in contact lenses. She was like 8 or 9 as a -4, and I didn't feel comfortable putting her in contact lenses at that point. So I got her goggles, and she was probably bullied a little bit because of the goggles. Kids are mean sometimes, so it's hard to convince kids to look different. Even adults don't like it. So
Yeah, but I think, especially you said she was talented. You're a good player. They tend not to
Mhm.
say too much. Like my sister was a very good basketball player, so no one really bothered her. She was the only one out there with goggles for a while, and then other people kind of got on board. But same thing, my mother did not want to put her in contacts, so that's why she went to the goggles. And then even when she could have worn contacts, she still wore the goggles. So
Yeah, my daughter turned, I think it was 12, and I put her in contact lenses, and it just totally changed her personality. The confidence went up, and each person's different. Your
Right.
psychology and personality is different. What bothers one kid might not bother another kid. So the contact lenses was just a huge boost for her self-esteem and her confidence. So it's just something to consider as you're trying to figure out what works for your kid, or even for an adult. You need to think about how they're perceiving it and how that's what kind of response they're going to get from their peers as they're using that eye correction.
yeah, I can't see in front of me, I swear. So I did this deep end swimming class thing, exercise. It was so hard, but and I can swim, so I was like, my God, we were 16 feet. And I know in the pool, I opened my eyes in the pool because my mother, she was one of those people that goggles she didn't feel were necessary. So we never wore goggles as kids. We didn't wear the nose plug, none of that. So as an adult, though, I figured out, because I do open my eyes in the water, I said I should just probably put some goggles in case there's too much chlorine, my eyes won't burn. So I wear goggles. So I just wear my glasses to the pool and then take them out, and I take them off, and then I put my goggles on because I can see up here. It's just too far in the distance, I can't really see, and so I'm fine when I'm swimming laps and stuff. And I was like, I didn't run into anyone. And
Sounds like you need to come to Atlanta and get LASIK surgery. Sign me up.
And the funny thing, I'm 49 now. It has to have been like 25, 30 years. Our eye doctor started sending these things to say we were eligible.
Mm-hmm.
And no one in our household did it. No one. But me, my sister, I think my mom also got it. We all kept getting these notifications from the doctor. He's now retired. And none of us ever, he's like, I can do it. And none of us. And, also the man next door, he had got it done. This was a long time ago. And he had a lot of difficulties with it and stuff. And so I think my mom heard that too. And so because I think I was asking her for it at the time.
Mm-hmm.
But I'm just like, I'm fine. I just wear my glasses. And then, like I said, I bought my little goggles. And then I found out you can go on Amazon and put in your prescription and you can get prescription goggles, which I did not know about.
I didn't know either.
Yeah, Zenni Optical also has a lot of
Zenni
products. Yeah, Zenni Optical also has some good products there too.
Yeah, so I get my glasses from Zlul. I love them. I think I'm on like pair number 4 or 5 with them. But and I do know I have some doctors that I know that do use Zenni as well. But yeah, I didn't know that there was prescription goggles for the water until my friend told me that. I was like, oh, because I thought she was wearing her contacts, and then put on the goggles. So I was like, well, learn something new. Are there risks to the eyes of sun exposure when playing sports, Dr. Mitchell?
There are. So, UV exposure increases risk of cataracts over time. And then also certain sun sports, like, let's say, I've seen you can get like a keratitis from sun exposure. I've seen it getting sort of like getting an abrasion, like a corneal abrasion from, I've seen kids come in after skiing or something like that, or spending a lot of time at the beach. So that's something that can happen with sun exposure. Anything else,
So-
Dr. Khalifa?
I mean, I've seen kids when I was in Utah, a lot of pterygiums in young people. The sun exposure can cause growth of pterygiums. What you said is exactly right. Solar keratitis. And then you can also get severe sensitivity to light, as Dr. Mitchell was saying. So that's one of the signs that you've had too much sun exposure. You see it with people doing like water sports on the lake, for example, or snow skiing, where there's a lot of reflection off of the surface and it's hitting the eye. And that's the typical scenario where you see the sun exposure causing problems.
I know what I was going to ask you, Dr. Khalifa. What is the difference between the floaters you were talking about as a sign of eye injury versus the floaters that older people seem to get? As they get older, they start getting floaters.
Yeah. So again, going back to this eyeball here, a floater is any thing jiggling in the back part in the vitreous cavity here. Okay. The vitreous cavity is really interesting. Okay. It's made out of protein. It's a jelly. And the protein is collagen fibers that are going back and forth, crisscross, and it gives it this form to it. That jelly is attached very tightly in the front here along the front part of the eye. It's attached along the blood vessels in the eye, which you see here. And then it's also attached around the optic nerve. Okay. As we get older, the vitreous, the jelly, starts to break down, and it's like a rubber band. When you're young, that rubber band is stretched from side to side, and it becomes transparent when it's stretched. When that collagen breaks down, that rubber band snaps, and it coalesces like that, and then you see a little thing jiggling. That's a typical floater. We call that a vitreous detachment. The vitreous has detached from the wall of the eye. Now, after a trauma, you can induce a vitreous detachment. Okay, I've seen situations where there was so much trauma that it actually ripped the retina and caused like a macular hole. I've seen that before. Okay, so it rips the center of your vision right here in the macula, and you lose the central vision after the trauma.
Wow.
Yeah, that's also a catastrophic outcome.
Yeah.
Now, when we're talking about vitreous hemorrhage, so you can imagine blood vessels breaking from a trauma in the back and releasing blood, and then you see floaters from the blood. That's another thing that can cause floaters from trauma.
Wow. So if you start seeing floaters and it's not due to injury, it's whatever that happened in the old age, the collagen, whatever. Is there something you can do about that?
So if you notice floaters, you definitely need to get an eye exam, what we call a dilated eye exam. So what the doctor does is they put the drops in, right? And they open up this pupil, make it nice and big. It's called pharmacological mydriasis. Pharmacological meaning eye drops,
Yep.
and mydriasis meaning dilation, opening that pupil up so I can look in and check the retina. Okay, so you need to get an exam, and typically what they'll do is they'll take your eyeball and they'll look all around with they'll put the thing on their head. It's called an indirect ophthalmoscope. They'll hold their lens in front of your eye. They'll shine the light in, and what they're doing is they're scanning this retina side to side. They have you look up and left, up and right, left, right, down and left, down and right, and then they're going to take a Q-tip or some sort of instrument and push on the eyeball to bring this peripheral retina into view to make sure there's no tears in it, and that's called a depressed retinal examination. They're depressing on the eyeball to bring the entire retina into view. Now, let's say you get that exam. What we worry about when you get a vitreous detachment like that is that when that vitreous comes off of the wall of the eye, it can pull the retina with it. Okay, so you imagine this eyeball is like the wall in your house, right? The inside. Imagine you put wallpaper on this wall, right? And imagine you get a tear in the wallpaper, and then you get fluid going under that tear, and then you get the whole wallpaper coming off. So if that retina comes off of the wall, the retina gets its nutrition from the wall. There's blood vessels under the retina. If it comes off the wall, then the retina dies, and you don't get good vision again. So you got to get that retina back on if it detaches. And that's why we consider a retinal detachment like an emergency. We got to get that patient in and get that retina reattached. What can be done for floaters? So let's say you get checked out. There's no retinal tear, no retinal detachment. There are people now in the community, in the eye surgery community, where they're recommending using lasers to break up floaters. It's not something I recommend or do, but there are people out there who recommend it. There is a risk to the laser that I don't think is warranted. But again, this is something that's evolving now in the field of eye care. There's also the ability to go in there and do a vitrectomy, where there's a retina specialist. They put ports in the back of the eye and they break up all the jelly in the back there and remove the vitreous. That's called the vitrectomy, removal of the vitreous.
Wow. Okay. What are some of the, and this is for both of you, what are some of the worst sports related eye traumas you've seen?
Oh man. Or do you want to start with the kids or the adults, or we can go back and forth?
Kids, back and forth is fine.
Okay, so 2 little girls decided that they thought it was a great idea to throw mechanical pencils at each other's faces using a pillow as like a dart, like a, as a target, and someone had
pulled down too fast, and the pencil went into her sister's eye. That's one. Yeah. And then maybe a few weeks later, some boys did that with actual darts. And how children don't tell parents, didn't tell mom for a couple of days. Oh, I could keep going. A boy thought but it wasn't sticking out of it. He came out.
No, they pulled it out. A boy thought he was going to turn some pants into shorts with a knife, and the knife slipped. I mean, we can kids do all sorts of things.
What about you, Dr. Khalifa?
One of the worst traumas I've seen is somebody who was an equestrian athlete, and the horse kicked him in the face. And they just smashed all the bones in the face, and that was a really bad traumatic. They got everything. They got a traumatic optic neuropathy. They had a retinal detachment, traumatic cataracts, the glaucoma. It was super bad. I've seen baseball injuries. I mentioned before, but a kid got hit with, outfielder goes for the ball, trying to catch it, misses the ball hits him in the eye, and they break their bone. They go to the emergency room and they miss it in the emergency room because they don't make them look up where the muscle is being held back by the broken bone. Basketball, seen a lot of retinal detachments, even in professional athletes here in town. We've had the Hawks players in practice. One got poked and developed a retinal tear, had laser. A lot of professional basketball players have gotten, you remember Amari Stoudemire, for example, he was poked in the eye, had retinal detachments bilaterally, and he was, at the peak of his powers as a basketball player and with the New York Knicks, and he had retinal detachment repairs. It just goes on. Recently, just this past month, I had a tennis player. He's in his 60s. His partner hit the ball right at him, didn't mean to, but hit the ball at him, hit his eye, popped his eye open. He lost his lens and had a retinal detachment. We're operating on him next month to fix the situation, hopefully. So, sports are not benign. Definitely, eye protection is helpful. You can't prevent everything, but especially racket sports, where an eye protection is helpful.
Yeah, I play tennis, and I do not play tennis without my sports glasses. So, yeah.
I've seen, speaking of sports, fishing. I've seen kids with hooks.
Oh,
yeah. So I've seen that too.
The hook will go in the eye with the fish hook, and that can be super traumatic, obviously, because that hook goes in, tears the iris, and then causes a traumatic cataract is typically the story. And then these young kids are having to deal with, pseudophakia, artificial lens in their eye the rest of their life.
And then the sequelae of that, right? So the damage, potential, angle injuries, potential glaucoma down the road. So it's not just the immediate trauma, it's the sequelae of that down the road that we're trying to educate to prevent.
And then with swimming, I've seen lots of patients who get acanthamoeba, right? They'll get infections with this parasite called acanthamoeba. It goes into their eye, and it is extremely painful. It goes and actually eats the nerve in the cornea, and it just causes so many problems. I've been treating one patient now for about a year. The world's expert on acanthamoeba is in Chicago, and he travels back and forth between me and that guy in Chicago. And I've done 3 corneal transplants on him, trying to get rid of this acanthamoeba.
Wow, there's a girl that was on TikTok or Instagram, and she went viral, and she was talking about the warn. She was giving basically a PSA about do not wear your contacts, in the water, and be very careful with water in your contacts, and you're not supposed to get water on them, and da da da. And this is why. And I think she had started documenting because I remember her being in pain and red eyes. So I think she started documenting, and then she kind of put it all together. But yeah, she went in length and talked about that.
Yeah,
it's very serious. Yeah.
Yeah, contact lenses are super tricky because people think they can just sleep in them all the time, and they'll go months.
Well, they came out, when I first started wearing them, you couldn't sleep in them, but then they came out with the daily ones that you can, keep in for a month and then throw them away, and
Yeah, I think if you'll talk to corneal specialists, nobody would really endorse sleeping in contact lenses.
Right.
We all recommend taking your contact lenses out. Make sure that you boil your contact lens container at least once a month, or change the contact lens container out once a month. Don't just keep using that same container over and over again, because what ends up happening is you'll get a bacteria in that contact lens container, and it'll make a biofilm, that slimy stuff in there, and that harbors bacteria, and then that'll transfer to your contact lenses, and that's how you get the infection on your eye after removing the contact lens out of the container. So my daughter, who wears contact lenses, I get her the daily disposable. She pops them in the morning. End of the day, she throws it away. And for some reason, she likes to throw them on the ground in her bedroom. So I find like dried contact lenses all over the place.
So for my patients who wear contacts, daily disposables, like these are kids, it's just so easy. Just toss them, wear them, toss them. Just do not rewear them. Do not keep wearing them. I have seen kids with acanthamoeba who have gone swimming in a lake and with their contacts and end up with a really serious infection.
I live in lovely Chicago, and we have Lake Michigan, and folks laugh at me. I don't swim in Lake Michigan because med school. I was like, before that, when I was a kid, when we went to day camp, we would be in rivers and lakes. It was no big deal. But after med school and learning about river blindness and all this acanthamoeba, I was like, no, I'm okay. If it's not chlorinated, or it's not salt water. And I'm talking about salt water where I can see things. I can see, because I went to the vineyard, Martha's Vineyard, and I was like, I don't care what y'all say about that being the ocean. It's not blue. And then I was half tempted to try the polar bear plunge, but I brought a wetsuit because I was like, I just don't think that I should be that exposed to that water. Because my dad, he's from the islands, he's from Antigua, and he says he doesn't swim in anything he can't see his feet in. So I was like, exactly, oceans and chlorinated pools. So yeah, and I definitely won't wear contacts in there, but I know I'm like, nah, I'm okay with the lake. I'm okay.
Yeah.
You mentioned Chicago. About 15 years ago or so, there's a huge acanthamoeba outbreak in the Chicago area. And they found out it was because the water processing facilities had changed their protocols. And I believe they stopped using ozone or something. And they had a huge amount of acanthamoeba. And they did a lot of epidemiologic studies, and they tied it back to the water purification system.
Wow.
Yeah.
Wow. Yeah. So yeah, that's serious stuff. And I always tell people, because like I told you, I talk about asthma and allergies a lot. And I tell you have to breathe to live. But I think a lot of us like being able to see. So I usually don't play when it comes to my vision, which is why when I do wear my contacts, I don't sleep in them, not on purpose. I actually, one night, I didn't even realize I went to sleep in them. And the next morning I'm on my phone. And so then when I put my glasses on, I panicked because I couldn't see. I go, what happened? And that's when I go, oh my God, you didn't take these stupid contacts out last night.
I've seen patients put multiple contacts in too. Like they have a contact lens in there.
I just watched a video 2 days ago, and the doctor was taking out contacts, and I know she said she was up to 12.
I think I've seen that video.
But one time I couldn't get it out, and actually my parents tried, both of them. Nobody could get it out. The next day, it finally moved to where we could get it out, but I just couldn't get it out, and I was like, I know it's still in there. I didn't take it out, and finally it came down the next day, and we got it out. But it was stuck. I was like, I guess it's just gonna be there. Dr. Mitchell, what exactly is optic neuropathy, and how does it impact our vision?
Okay, so optic neuropathy is one of those like worst case scenarios with eye trauma where the optic nerve, which is the cable that connects the eye to the brain in order for us to be able to see and process visual information, it gets damaged. And there are severities of optic neuropathy where it can be mild and you still retain vision to some degree, and where it can be severe where you lose vision completely and vision cannot be recovered. So that is what an optic neuropathy is, when there's trauma to the optic nerve, which connects the eye to the brain.
Got it. And so, of course, obviously, if we have that issue, then you probably, yes, there's the optic nerve, and you can't, you be able to see, but you not be able to make out what you're seeing.
Correct. So again, there's a range of severity.
Okay.
So I've seen patients who've had optic neuropathies from trauma and other, let's just stick with trauma since that's what we're talking about, where it's mild. So the vision went from being 20/20 to now it's, let's say, 20/50. So it's reduced, but not completely gone. And I've seen patients where they've gone from being able to see perfectly fine to no vision whatsoever.
Okay.
Yeah.
Got it.
One case I can think of is when I lived in Pennsylvania, was a kid who was sledding and ran into a tree and hit his head and sustained an optic neuropathy from that.
So can sports-related eye injuries lead to permanent vision loss? This is both of you.
Yes, we had talked about, detachments of the retina, macular holes, traumatic optic neuropathy, things like that. So there are definitely some things that can cause permanent vision loss.
Got it. And what should parents, teachers, coaches, etc. do right away after an eye injury happens?
So I'll start. I think it depends on what the injury is, right? So if it's one thing I want to get across, that if it's a penetrating trauma, like something went into the eye, do not rub the eye, do not poke the eye, do not press on the eye. That example I gave you of that little
What
girl,
about, should they take it out?
No, don't touch it. Don't pull it, don't touch it. Put some sort of like a cup or some sort of shield that doesn't put any pressure on the eye, something that there's space, but where the child isn't going to touch their eye and get to the emergency room. But that example I gave you of that young girl who with the pencil, that they were throwing the pencil, she had a penetrating injury, but it was made worse because they put a patch over the eye and pressed the thing deeper into her eye. And so it went further into the eye and resulted in further trauma because of that.
Okay.
Yeah. If it's something chemical related, let's say there is, it's from swimming in the pool, let's rinse the eye out, if it's something like that. We want to try and flush the eye out as much as possible for like 15 minutes or so. But the big thing I want to get across is do not apply pressure. Shield the eye and get emergency care.
Okay. What about you, Dr. Khalifa?
Yeah, I think there's a wide spectrum of what constitutes an eye injury, right? There's like a little poke and, they get hit and it's a little uncomfortable for a few minutes and then they're back playing and they don't have any complaints. And there's, all the way up to vision loss and more severe. I would say if a child has persistent vision complaints over the course of like 15 minutes, I would stop the activity and then get him to an eye specialist.
Smart move. And then how quickly should a child and adult see an eye doctor after an eye injury?
Yeah, I mean, it depends on the severity. So if you got a baseball to the eye, you need to get to the emergency room and need to do the scans and make sure that the muscles are okay and the nerve is okay and what exactly is broken. If it's a poke in the eye and you're having flashes, floaters, you need to get to an eye specialist. I think the emergency room, I would probably bypass urgent care and go to
Okay.
the emergency room and see a facility that would has access to an ophthalmologist on call or an optometrist on
That's
call.
what I was just going to ask you. Do most ERs have an ophthalmologist on call?
It depends where you live. In some rural areas, not necessarily. In most major cities, yes. But it really depends where you live.
Okay. And then, so if, so basically, if a baseball hits the guy in the eye, then we need to stop the game and go now.
Yeah, I would. Yeah, if there is a high velocity projectile that is quite hard like a baseball and it hits the eye directly, you need to go get checked out. Even if the child doesn't, even if the child wants to play on, you need to go get that checked out. You know that needs to be seen right away.
Got it.
Mhm.
Got it. So please tell people how they can find you guys. This has been great information. I know with the start of the school year and everyone signing up for the different sports and everything and figuring out what they're going to do. And mom and dad's going to purchase all the equipment. I was watching my lovely Lions last night, and I saw several of the players do have some sort of protective shield as a part of their helmets. Not all, but some of them. And
Which I think is great.
yeah, me too. I was shocked because I know back in the day I never saw that before. So I was glad to see that some of them do have that.
So interesting piece of information. It used to be where they would wear reflected, like tinted shields, and then the NFL made that illegal. That you can't wear tinted eye shields because it gives an advantage that the opposing player can't track your eyes.
Mm-hmm.
You'll see all the protection now is clear, and that's allowed. One of my colleagues, we were doing the Falcons training camp, and he mentioned to me lots of players before used to ask for medical dispensation for the tinted shields, and now I think the NFL did away with that.
Wow.
Yeah, maybe there are some players who get dispensation for it, but I think in general you won't see the tinted eye shields.
Right. No, they were clear. Wow. Okay. But yes, tell us how we can find you, and in case there's other questions. We'll start ladies first.
Okay, I practice in Atlanta, Georgia. And I am in a private practice called the Thomas Eye Group, and I'm a pediatric ophthalmologist and a neuro-ophthalmologist in our practice.
Okay.
Yes.
Yeah, when Dr. Mitchell was coming to Atlanta, we tried to bring her to Emory, but she wanted to go into private practice. I'm at the Emory Eye Center. You can find me if you Google my name, Yusuf Khalifa. You'll find me pretty easily there.
And then I have one question that we didn't ask. At what age should children go to the eye doctor?
I love that question. Thank you for asking. So my recommendation is that, okay, it's going to be two-part. If you wear glasses and you wore glasses as a child, your child probably needs to be seen sooner just to make sure they haven't inherited whatever's going on with your eyes, right? But I recommend that every child should get an exam with either a pediatric ophthalmologist or a pediatric optometrist by preschool age. Because that way, if we find, so I say like 2 to 3 years of age for a baseline exam. That way, if we find anything at that point, we can say, okay, yeah, you should definitely follow up sooner rather than later. I did it with my children. I started wearing glasses when I was probably about 7. And so I had my children examined when they were both around 2 years of age. They're fine. They inherited their daddy's eyes. They're great.
Oh, wonderful.
I know, right? so they've been great. But yeah, I say like preschool 2, 3 years of age, at least get a baseline exam then. The great thing now is a lot of pediatricians' offices now do the photo screeners. So they're catching a lot of children who need to be seen. So that we do get a lot of referrals from failed vision, quote unquote, failed vision screening at the pediatrician's office. These tests often have a high false positive rate. So, kids are squirmy. So sometimes it picks up something that may not necessarily be there because the child isn't the most cooperative. But I would rather them get checked and us say, hey, everything's great. We have nothing to worry about. Because sometimes when they come in, I'm like, oh, yes, I am so glad you were here. So, yeah.
Yeah, those screening tools, false positives, whether that be pediatric screening or diabetic retinopathy screening, we really don't mind the false positive. What we worry about is the false negative, where somebody
Correct.
actually has something and the machine tells you, no, there's nothing there. So
Correct.
that's, and to Dr. Mitchell's point, exactly.
Yeah, and I remember back in the day when they used to do the eye test in school.
Yes.
And that's how I got tested. And my mother knew I wanted to wear glasses, so she didn't believe me when I came home. And I said, Mom, they said I need glasses. And they said I need to get my eyes checked. And she said, did you fake the test? And I was like, no. And so I started wearing glasses in 3rd grade. So that's 5, 6, that's about 8.
Yeah.
8,
Yeah.
9, yeah.
Same. I failed at school as well. And I was just like, did I really fail? Did I not? My mom was like, she knew I wanted glasses as well, because one of my classmates had just gotten glasses, and they took me to the pediatric ophthalmologist, and he was like, oh yeah, she needs glasses.
So if you see your child's eyes deviating out or in, also that is a sign. My number 2, I'm an ophthalmologist and I missed it. My kid's eye was getting exotropia, right? Her eye was veering out and she's myopic. Myopic patients tend to have exotropia, eye veers out if they're nearsighted. And if they're hyperopic, they tend to turn in.
Because they're looking to focus.
Mm-hmm.
Yeah.
So if you're a parent, you notice your kid's eyes drifting, at my religious facility, I see a kid whose eye is out, and I keep on telling the dad, get this kid checked because they have exotropia. So you just watch the alignment. That could be a sign that glasses are needed.
Yeah.
So I want to, piggyback on that. So sometimes parents come in when the child is, let's say, 8, 9 years of age, and they've had a history of an eye crossing or drifting for a long time. And I was like, how long has this been going on? Oh, since they're about 2 or 3, we thought they would grow out of it. They're not going to grow out of it. Please get them in to see a pediatric ophthalmologist or a pediatric optometrist just to get an evaluation. I will give you an example. Today, I saw a child who mom said a month ago, he's 3, a month ago, she started noticing that one eye started drifting. And she just wanted to get it looked at, just want to make sure it wasn't anything. No family history. I looked at him, I examined him, and I thought, in my mind, I was like, it's going to be just bread and butter strabismus, straightforward strabismus. No, he actually has a retinal disease, and that's what's causing his eye to do this. And so it was a lot for her to process. It was a lot to process, when you come in thinking my child just needs glasses and now he needs to see a pediatric retina specialist. But it was a great diagnosis to be able to make, to be like, okay, we caught this early and this is something that can be done. So,
what's also interesting is this disease or this development called amblyopia, right? So your brain is giving real estate to each eye. And if both eyes are seeing well, your brain divvies up the real estate between the 2 eyes because they're equally capable of seeing. If one eye is weaker than the other, then the brain starts getting more real estate, more vision real estate to the better eye.
Well, yeah.
And then that's sort of malleable. Is that right, Dr. Mitchell, up until the age of about 14, 12, 14? And then
a little younger than that, more like 10, 12.
Oh, wow. So if you miss the boat and you're not intervening while that wiring is happening, that amblyopia becomes locked in and you really can't do much to bring back the weak eyes. So, I defer to Dr. Mitchell. This is her area of expertise, but amblyopia is very interesting because researchers who look at wiring of the brain, they use amblyopia as a model of how the brain wires. So they're able to get mice and block one eye and watch how the brain rewires and then open that eye and then see the rewiring happen again. So it's the visual system occupies a tremendous amount of our brain capacity. As a matter of fact, there are cranial nerve 2, 3, 4, 6. Those are all of the 12 cranial nerves. All of those are dedicated to vision, right? So, you have the majority of your nerves that come out of your brain in the cranial aspect of your brain. They're going towards vision. So it's a super important part of development. And if your kid's eye is veering out or in, make sure you get them checked out before it gets more serious.
Absolutely.
Well, thank you so much. This was, like I said, amazing information. And I'm glad I was able to ask about when they should go to the eye doctor because, everyone always thinks, well, when they're older, because they can't really read the 'Cause, you know,
They don't need to be able to read.
exactly.
We can figure it out. Bring them to see us.
Exactly. Well, thank you so much. And everyone, please have a great evening and we'll see you next time.
Thank you.
Thank you.